Could you tell me a little bit about yourself?
Yeah, my name is Gidget Delalas. I work at Integra Health and Wellness as a utilization review nurse. Utilization review nurses, we are the ones working for the insurance company to make sure that the patients are getting quality care through their insurance company. We review for them to meet the criteria to get things done in the hospitals, procedures done. We check to make sure that they're meeting the criteria to stay in the hospitals for the amount of days they're supposed to stay, and that their cost kind of stays down, and we just keep check on everything, keep the hospital costs down, the patient's costs down, and make sure everything, they meet all the criteria for getting procedures done, and that helps everybody.
How long have you been a nurse?
I've been a nurse for 20 years.
In your opinion, what are important qualifications for a nurse to have?
They should be able to multitask, they should be compassionate, they should be able to do a lot of things at a lot of different times, know technical things, be able to tolerate different cultures, different people's personalities. Very important, because you run into a lot of different people in this field.
Do you know anyone that has served in the military as a nurse?
Yes, I worked with nurses in the emergency room, and a lot of them came from the military, and they got a lot of their training there, and then they came back and had more training, and they worked as nurses, and it was very fulfilling, and they're taught very well there.
In your opinion, what would be some differences of military nurses versus civilian nurses?
The military nurses, they get a lot of more rounded education, I think, because they're actually out there hands-on doing things that civilian nurses will never see. They get to experience bigger and better things sometimes, but then there's the drawbacks too. But they get to really do hands-on nursing, if kind of emergency nursing is what you like, and helping people who are really injured, physically and mentally too.
Yeah. Do you think that there's more stress in that role than the civilian role, and do you think that they deal with more uncommon diseases overseas?
They probably have more common or uncommon diseases than what we see, because in the United States we have more things that they have a little more handle on. But I think their stresses are more, they're away from their family, they've got a lot more cultural differences, and they're in combat.
Yeah.
But here nursing is stressful too, because there's just
different types of stresses.
Different type of stress. There's stress everywhere.
Yeah.
What do you think some advantages would be as a nurse in the military?
In military nursing, you get your education paid for. You get a well-rounded ability to learn everything. It would be nice just to go to different countries and really see the hands-on emergency part of the nursing. Be very interesting.
What do you think are some of the biggest challenges nurses face today?
I think the cutting costs and having to take care of more patients, less staff. You have to be more technical. People are coming in sicker into the hospitals, so you're having to take on more people, sicker people, less help, as having a lot of hospitals are getting rid of the nursing assistants, so the RNs are left to take care of the patient all by themselves instead of having a team approach. Everything's done by the RN themselves, which is very stressful. So,
Thank you so
Well,
much.
thank you so much.
you're very welcome.